Emotional abuse is literally any action that causes a nursing home patient emotional harm or anguish, and can be verbal or nonverbal. Emotional abuse, also called psychological abuse, can be very harmful and lead to long-term mental health damage and the decline of physical health as well. A survey by the National Center on Elder Abuse revealed that 33.4% of nursing home residents experienced emotional abuse, making it the most common form of abuse experienced. Unfortunately, an elderly person living in a nursing home may be too scared to say anything about their abuse, or not have the cognitive facilities to let others know about their treatment by their caregivers. The most common forms of emotional abuse include intimidating and threatening a patient, ridiculing and insulting a patient, making a patient feel guilty or distressed, yelling or shouting at a patient, giving them the silent treatment, isolating them from friends or family, preventing them from participating in social activities, threatening to withhold food and water. Psychological abuse causes many people to become timid, withdrawn, and depressed. In other cases, they may become more agitated and angrier. There is a number of symptoms of emotional abuse in elderly nursing home patients, but these may initially be difficult to spot. However, as the abuse progresses, they become more evident. Things to look for that may indicate abuse include depression and withdrawal, refusal to interact with others, sudden change in personality or behavior, agitation, excessive fear or nervousness, unusual behavior such as sucking, biting, or rocking. If the abuse continues, residents may begin to exhibit physical symptoms as well, such as loss of appetite, lack of sleep or insomnia, sudden weight loss, refusal to eat or take medications, increased vulnerability to injury and infection. There are certain nursing home residents that may be more susceptible to emotional abuse. The older the elderly individual and the more severe their illness, the more likely they are to be abused. Other factors that significantly increase the risk of emotional abuse: divorce or separation, mental or physical impairments, low income, race, increased need for help with daily living tasks. Those with severe memory impairment or cognitive problems are also more susceptible to emotional elder abuse. It's possible that anyone who's around the elderly patient may commit emotional abuse, including family members who are reluctant to care for an elderly relative. It can also happen when the family member is stressed, has anger management issues, or is under the influence of drugs or alcohol. At nursing homes, the most likely perpetrators of emotional abuse are overworked and frustrated staff members. When nursing home staff members are overworked, there's an increased risk of poor service quality and unsafe resident conditions, and they may take out their frustrations on the very residents who are under their care. It's important to pay attention to the mannerisms of the patient to determine whether they're exhibiting signs of abuse. If they're acting much different than they normally do, make sure to notify someone who can assist, such as a medical professional or social services. Many elders aren't in a position to defend themselves or make sure they're being treated fairly. Checking in on them regularly and notifying staff if there appears to be an issue can help make sure they maintain their well-being in their later years. It's important to document symptoms of emotional abuse and give details to the nursing home administration. Stopping the abuse and getting your loved one appropriate treatment is critical. Otherwise, they may experience additional issues such as anxiety or depression and worsening of current medical problems. In the end, if your loved one is being emotionally abused at a nursing home, you may need to move them to another facility. Symptoms of psychological or emotional abuse may be treated in a number of ways. Counseling by a social worker or other mental health care provider may assist with the depression, anxiety, and fear. Medications can help your family member calm down, relax, or sleep better. These medicines might include antidepressants or anti-anxiety medications. Medical care may be required if the abuse caused a physical condition to worsen or a new medical condition to appear, such as digestive problems, severe headaches, hypertension, fibromyalgia, or chronic fatigue syndrome. The abuse victim could need other medical treatments to treat their illness. If nothing changes, reach out to your state government for assistance. They have advocates who work on behalf of residents in nursing homes or other similar facilities. The Administration of Aging oversees the Long-Term Care Ombudsman program. You can find the contact information for your state through the Consumer Voice website. In addition, Adult Protective Services can also assist with filing a report of suspected elderly abuse. By knowing the warning signs of elder abuse, you can help keep vulnerable people safe. If you believe a family member was injured due to elder abuse, maltreatment, or neglect in a nursing home, reach out to us for a free case evaluation. We listen to your concerns and help seniors receive the care they deserve. nursinghomeabuse.org, exposing nursing home abuse and helping seniors get justice.